We're just going to wait a few moments. We still have participants joining. Just a reminder, once you join the meeting, please make sure that you turn your camera off. Wonderful. Just wanted to make sure that our live stream was running smoothly on our CDGM Facebook page. So do we have the go ahead? Wonderful. You'll see me navigating a number of different screens throughout the meeting. I have our live stream on one, I have the actual meeting, and then I have team support as well. So you'll see me fluttering about over the meeting today. We'll give everyone about 5 minutes or so, and then we'll start. I still do see more people are joining the meeting. And so as a reminder, once you join the meeting, please make sure you turn your camera off. I think we can begin now. I am excited to start, but before we do, I think it's incredibly important that we begin with an acknowledgement that we are hosting this on Indigenous lands. The head office, as it were, is located currently on the unceded territory of Coast Salish, as well as the Kwanlin area. We acknowledge, recognize, and thank all of the Indigenous individuals who have allowed us to live, work, play, and gather on this land. Today's panel is focusing on healthcare. And as you may already know, we did host a discussion last month on interpreter training programs. And so from that, we know already that there are not enough interpreters working in the field. The number of interpreters is not able to meet the demand for interpreting services across Canada. Oops, one moment. There are 4 interpreter training programs across the country, but in the fall, that will be down to 3. And so, given that a number of the programs are under review, that certainly will have impacts. Coming out of that, we know that when it relates to healthcare interpreting specifically, there's already a dearth of interpreters. And so now with new technologies such as VRS and VRI, video relay service and video relay interpreting, they've already begun. But for people who live in a large urban area, they're able to book interpreters either in person for doctor's appointments, for hospital visits and things of that nature. But for anyone who doesn't live in any of those urban areas, for anyone who lives outside of the city, it can be incredibly difficult to book interpreters. Sometimes interpreters may not want to accept that work because of the travel costs or the travel time. And really, we also do have to value and respect the interpreters and their time as well. Sometimes they give up quite a large amount of their time to exit the city and arrive in person at a remote site. Over time, we do know you can use VRS to call 911, for example, and you can also use VRI technologies. There's also 988. 988 is a mental health crisis support line. And so there are now more opportunities for deaf individuals through those technologies, but we still haven't solved the problem of insufficient interpreters. Some people think that it's easy for people in remote areas to just make use of VRI interpreters through technologies, but sometimes the internet signal is not strong enough. Sometimes the technology is insufficient. Other times, depending on who works in the hospital or the doctor's office, they may not have an in-depth knowledge of the technology. And so they have a screen set up, and yet there's no interpreter actually provided on the screen. And so with that, for us as deaf individuals and our access to healthcare, that causes a number of problems. I'm sure you know before from the famous Eldridge decision that was originally done here in BC, that was related to an issue of failing to provide access to interpreters in healthcare settings. And so many deaf individuals faced many miscommunications and frustrations. And so one deaf family actually began lodging a human rights complaint in 1997 against the Ministry of Health in British Columbia. That complaint was later denied and ended up escalating to the Supreme Court of Canada. And through that Supreme Court case, they won, and the decision was made in 2004 to provide and mandate medical interpreters and access to interpreters and medical services across the country. Stemming from that, we've seen a number of new changes in technologies. Some people think that it's fine where we're at right now, but we still do need to let the government know that we as the deaf community have a number of issues and problems that have come up through interpreter services in healthcare settings. Through those problems and by having a conversation with the government, we can also then propose solutions. Part of this is learning about individual experiences. Maybe you were in a hospital or a doctor's office with no interpreter, and there were a number of communication mishaps because of that. But today is an opportunity to discuss the information more in depth. So we do have a number of panelists who will be sharing as part of the discussion, and we've curated them for people specifically who are responsible for providing interpreters in healthcare settings. We'll start on the East Coast and make our way across the country, introducing our Western panelists last. So the first is from CAV, the Canadian Association of Video Communications. So they're one of the providers for video relay services. And so I'd like to introduce Wisum Constantine, just double checking the spelling here. I just wanted to make sure I got their last name right. So I did, that's wonderful. And so I'd now like Wisum to come on camera. Wisum speaking, hello, bonjour. Do I remain on camera? Just checking that Wisum's clear on the screen. Yes, great. And so maybe Wisum, go ahead and introduce yourself, where you're currently working, where you're located, as well as what CAV is responsible for as it relates to access to 911 and 988. So let's say, for example, if I experience an emergency situation and I need first responders, I call 911. Once the ambulance arrives, does that mean that the VRS call is finished? Because I then wouldn't have access to people in the ambulance or at the hospital. So do you mind explaining a bit about 911 services through VRS? Absolutely. Before I go, I'd first like to recognize that I am currently situated here in Ottawa, Ontario. And this is the unceded land of many Indigenous peoples. Now that I've done that, I'd like to introduce myself. My name is Wisum Constantine, and my sign name is the number 1 going across my forehead. And I'm the coordinating manager for CAV, for CAV. To answer your question, Kim, CAV, as it provides service through Canada VRS, does have access to VRS services through 911 calls. And so that means that people are able to access an interpreter when they place those calls. The interpreters employed by CAV are already trained and know how to properly manage emergency calls. Once you place that initial call, depending on which number, they would identify your local area, and they would then connect you to a local PSAP. Once you are connected, that would be police, fire, and ambulance services. And depending on the situation, they would send to the appropriate service provider. Let's say, for example, if it was a situation where you needed medical assistance, the ambulance would arrive at the patient's house. They would then take them to the ambulance and connect to VRS. They would make sure that the individual has access to communication through interpreters. They would do an assessment of their medical history. And then once they arrive at the hospital, at that point, they would disconnect the call. So PSAP would then disconnect the call once you arrive at the hospital. I hope that answers the question. Just a moment to switch ASL LSQ interpreters.
Come on.
Great.
In 1998 for calling 988, that's the mental health crisis number. If you need any mental health support, emergency crisis support, you can call a professional or a qualified individual at 988 through the services of VRS as well. CAV is working to set up policies to ensure that all of the interpreters are trained and ready for those types of situations, to ensure that they can provide quality accommodations and services for all of the deaf callers. The policy and information coming from CAB will be ready in November of 2020 and shared in November of 2023. There are 3 alternate numbers, 811, which includes several numbers, and that can be called directly through VRS, 811 on your phone. Kim, did you have any other questions for me? Great, thank you so much, Wisum. This is new information for some people, 988 specifically. Just sharing for everyone that this was recently passed by the CRTC, and they have finally set up 988 to be used through VRS as well. And CAV did submit an argument making sure that this would be accessible for all deaf callers as well. So it is now accessible not only for the hearing public, but for deaf individuals as well, making sure that this is equal access. So going forward, I look forward to seeing in November of 2023 CAV's new policy. Perfect, Wisum said, thank you. I'll save conversation and questions for later during question and answer. Now I'd like to move on to CHS. Bev Dooley.
Yep.
Bev Dooley works for CHS. The interpreter missed her role.
Manager of Client Experiences.
She provides services for all over Ontario, specific to interpreting services, and that's interpreting in medical and community settings. Today, we're talking specifically about medical settings. Welcome, Beverly. Thank you, Kim. I'm assuming it's the same question for me that you just asked Wisum about CAV? Yes, great. Our interpreting services at CHS, our main mandate is focusing on mental health. interpreter correction, medical and health. Community needs, whether that's booking interpreters for medical, mental health, surgery, ophthalmologist, a variety of situations, CHS would provide interpretation services. In March 2020, when COVID took over the world, there was a strong change in the interpreting services to video and remote interpreting. It was challenging for the community because this was new, technology was a big part of it, so there was an education piece that came along, and eventually people got used to using virtual interpreting services, and now CHS is proud to provide both in-person and virtual interpreting services. Typically, we'll ask the deaf consumer if they have a preference. If they prefer the interpreter to be there in person, we will look for an in-person interpreter, and if we are not able to find one, we will offer the potential for VRI interpreting in lieu. And if the deaf consumer is comfortable with it, then we will go that route. So that's typically how we follow our processes when booking an interpreter. Day services, meaning not emergency services. An individual can contact CHS directly. We also have 24/7 emergency interpreting services, and that's for Ontario area only. An emergency such as having to go to the hospital, Children's Aid Society, or Family Social Services, we will send an emergency interpreter for that. Addiction services as well, that is considered emergency services. Funeral services, we would consider that an emergency services. There is an extensive list of situations that would be considered emergent services. Not your everyday dentist appointment where you already have an appointment ahead of time, or doctor appointment. This is something that comes up last minute, overnight, where you need an interpreter in an emergency situation. And we do include funerals in that. That was recently added to our emergency list. We also provide services in non-medical settings. For example, staff meetings, conferences, and so on and so forth. We do provide interpretation services for that as well, bank services, but our main focus is mental health and medical interpreting. At CHS, we have staff interpreters, approximately 30 staff interpreters who work 9 to 5, Monday to Friday. Sometimes they are flexible in their hours. Perhaps someone has a surgery at 7 o'clock in the morning. The interpreters would be able to flex their schedule and change their hours to make sure that that is provided service as well. Sometimes, unfortunately, interpreters may not be available, and freelance interpreters' schedules change all the time. So depending whether or not they're willing to accept the work and available at that time. We provide virtual interpreting as well. We prefer Zoom for our virtual interpreting platform, reason being it's the most secure. Other companies perhaps use WebEx, or we've seen Blue Quill. The interpreter's not sure what the Blue platform was.
Blue Jeans.
Blue Jeans. In that case, we give the link for that platform to the interpreter and they can connect that way. Skype is avoided because it's not secure. If it happens that there is issues with the internet, sometimes an interpreter may be willing, as a last resort, to connect with the deaf consumer via Skype, but at CHS, we don't recommend it. I think that answers your question, Kim. Yes, thanks, Timothy. Sorry, the interpreter talking to the team, and Kim's just saying, great, thank you so much, Beverly. There'll be further questions and we'll hold off till question and answer. And Beverly's asking, so I'm finished? Yep, you can turn your camera off. Thank you, Beverly. Kim's saying, moving on to Ontario Health Advisory. We have Travis Morgan with us today. Travis is here representing as Vice President for Ontario Association of the Deaf, but here he is not representing OAD. Today he is here as a deaf patient advisor. for the Ontario government. I'll give you the floor now, Travis. You can go ahead. Great, thank you. Hello. Oh, I feel like I'm close up. My name is Travis. Obviously, Kim just introduced me. I'm in Ontario and I work with Patient Advisory Ontario Government and Health. So I am responsible to monitor homes, programs in the community, in the Ontario community. My responsibility as patient advisor to Ontario government for rights and health, specifically for individuals with disabilities who are deaf, hard of hearing, and language deprivation. For Family Health Patient Advisory Group, all of us in this group are volunteers. There is an honorarium fee that will often be paid. Sorry, just a moment. So the government's looking for advisory information on how to improve the patient's experience. So as a deaf individual, I can share my experience or what I see, and then I offer that advice to the government on behalf of deaf individuals and deaf patients. We need people from Ontario to join the advisory committee, Ontario Health. You can look at our website, the Interpreter Missed the website, to find more information. Family and Patient Advisory. You'll see on the website, join the team. There's an application process. We are looking for more representatives with disabilities, specifically individuals with deafness. You send in your resume, and then we choose people to join the committee. Sometimes we need representatives in specific regions, Northern Ontario, London, or other areas in Ontario, and we are looking for specific reps. I think that's all I have to say. Thank you for this opportunity. Perfect. Thank you so much for that explanation, Travis. Now moving west, we have Wavefront Center in British Columbia. Wavefront Center, Accessibility and Communication. We have with us the manager, the manager for accessibility and communication. No, sorry, let me say that again. A manager for accessibility and communication services. Rich Miller is here with us today. Rich Newmiller, interpreter correction. Rich is on screen saying, thank you, Kim. Kim's asking if you can explain to us what you do at Wavefront, how you run services there. For Eastern Canadian Hearing Services, they have a contract with the Ontario government for medical interpreting and medical care, similar to here in BC. Wavefront also has a contract with the BC government for medical interpreting. So I'll pass the floor to Rich and you can tell us more about it. Great, thank you, Kim. Hello, my name is Rich Newmiller. I oversee several programs in regards to accessibility and communication. The first one being medical interpreting, community interpreting, ASL translation, plain language for documentation, decreasing or making the language more simple, and audio description. So these are the 5 programs that I oversee at Wavefront. The main program being the medical program, whether that's health, emergency, mental health. This includes many different situations, and we do provide services throughout the day and after hours, nights as well. We offer our services in person as well as remote. And here in BC, we have access to both in person and remote, depending on the individual's preference. And with HCP, sometimes we aren't able to send someone in person. In that case, we would have a video interpreter. And with video interpreting, we use Zoom, or the HCP, they use doxy.me for their platform. And the third one is WebEx as well. So those are the virtual programs we will see for connecting to an interpreter. We have 3 different areas, starting with Lower Mainland.
3 different staff interpreters.
Thank you.
For Lower Mainland.
Thank you, Timothy.
No problem.
For the different regions, Vancouver Island and Okanagan. Okanagan focusing on central and northern BC. The Vancouver region, there are 3 as well. And we provide services to the surrounding area. If there is no interpreter in the area, if there is no interpreter available in the region that it's needed, then we will offer virtual services. We do have interpreters ready to connect to hospitals or any other setting. And we have that available to provide that service provided if needed. We have a contract with PHSA. We follow that contractual agreement, which includes standards, expectations, and regulations that we have to follow. Services have been provided successfully since we started that contract. If there's a situation where we are not able to provide an interpreter, because there is a scarcity of interpreters, and we are starting to see that more and more in BC now, a shortage of interpreters. So far, things haven't been too bad. We have been able to fill needs when there are requests. So that's a bit about me. Rich at Wavefront. Back to you, Kim.
Interpreter switch.
Thanks, Timothy.
Perfect. So Rich, I'm going to ask you to stay on camera. What is happening? Perfect. Just had to add the spotlight. And Bev, do you mind coming back on camera as well? Perfect. Okay. So I do have a few questions for the 2 of you as representatives of Eastern Canadian services through CHS, but then also Western through Wavefront. When it comes to looking at and comparing each province, it seems that CHS would do the bulk of interpreting services for the Eastern regions, and Wavefront would be for the West, if I understand that correctly. Now, I do know that DHA, Deaf Hearing Association, is through Alberta, but what happened was the government ended up removing their contract. So it's now directly done through the Alberta government. The details on that still seem a bit unclear at this point, but in terms of the Lower Mainland services, and then comparing to the Toronto services, both of them are quite large metropolitan areas. And so what we've noticed is generally there might be issues with insufficient number of interpreters when compared to people who are living in more remote or rural areas, especially for in-person services. Let's say, for example, if somebody lives either in Northern BC or Northern Ontario, where there aren't as many interpreters available, I'm wondering, how do your 2 associations or agencies provide in-person interpreting services for medical care? So maybe first we'll start with Bev and then go to Rich. Bev speaking. If there's a serious emergency, CHS will provide airfare and accommodation for an interpreter to be there for a few days in person. Most of the time, unfortunately, it will have to be video remote interpreting. We're trying our best right now to be more flexible and to research additional options to better support them, but that's still an ongoing process. We also do have some contract freelance interpreters who are employed for the northern area, but in part it depends on what their schedule is like and if they're available to go in person. It seems over time, interpreters are becoming less and less available. I mean, there's a lot of competition. So VRS, Video Relay Services, is one example. Some interpreters work almost exclusively in college and university settings or in mainstream school settings. So that also does take a number of interpreters from us. But then also it seems that the number of deaf individuals living in Canada is considerably higher than the number of interpreters in Canada. Recently on Deaf Dots, through the Canadian Association of the Deaf, they said there are approximately 347,000 ASL users who identify as deaf across Canada. But really, I think for CASLI, the Canadian Association of Sign Language Interpreters, there's only about 847 or I think 900 interpreters. And so we are working on doing that, but we do quite a lot of work. Some people say that we don't necessarily do that, but we put in a lot of work to make sure we find available interpreters. Kim speaking. And now for interpreters who use LSQ and French, Bev speaking, yeah, we do have some LSQ interpreters in Sudbury, for example, as well as in Ottawa. There's a staff position there for an LSQ French interpreter. Kim speaking, wonderful. And now I'll ask you the same, Rich. Rich speaking. We don't have any LSQ users. I mean, we don't have any of them. So as far as most of the interpreters, most of them, I'd say the highest number work in the lower mainland area of the province. Altogether, I think 9 in Victoria Island. For Okanagan, we have 5. Thank you. That is in the northern area. Interpreter missed the finger spelling there. And so some of them will have to do quite a lot of driving. Sometimes we'll send them to fly to W. The interpreter doesn't know that particular city.
Depending on the weather.
Oh, thank you. Sometimes depending on the weather, they will have to fly, but we don't, if they're not able to do that, then we can also provide online services. Thanks, Alicia. Tim speaking. I do know a common challenge is that usually for more northern areas of the province or of the country, there are not sufficient access to internet. And I know that one agency is working on improving that. That's a separate issue though. But in terms of people that live outside of those main rural areas, CRTC is working on improving that area, that internet access. But I'm wondering what your views are on when internet access could be a barrier to clear interpreting services. Rich speaking, it really depends on what the consumer is using. We've noticed that sometimes tablets or iPads are not the best, and it's also dependent on the weather, especially during the winter time. That can cause some issues with actually receiving the video signal when it comes to downloading the stream. Sometimes it's fine, and other times it's not. Some individuals, when they're using their mobile data, that seems to be a bit more effective, but depending, some consumers don't have any data associated with their phone plan. And so when they're using Wi-Fi, just clarifying what folks' different signs are. Again, sometimes people don't have access to that. They might require a business's or an organization's Wi-Fi instead of their own. And so when it comes to using the hospital's Wi-Fi in a medical service, that is not effective because there are so many devices trying to access limited internet resources. So that could be a challenge. Bev speaking, absolutely the same. Tim speaking, yes. So I know sometimes, I mean, Wavefront is incredibly strict in terms of who can access their Wi-Fi and who can't. But really, we've noticed that there seem to be a lot of commonalities as far as hospital interpreting goes. Really, it depends on the equipment that people are using, and it also depends on access to a strong and clear Wi-Fi signal, for sure. I did have one more question connected to deaf interpreters and access to deaf interpreters. Let's say if I'm a deaf individual that has an emergency situation, let's say if I have a surgery or a pre-surgery consultation and they're explaining the process of the surgery itself, sometimes an interpreter will hear the English interpret that into ASL, but the deaf patient won't actually understand the ASL that's given to them. And so we have deaf interpreters, interpreters who themselves are deaf, who are able to provide much more clear language access and who are able to expand on concepts that a hearing interpreter couldn't. I've noticed, at least based on feedback I'm hearing from different deaf folks, that sometimes they're not 100% satisfied with hearing ASL English interpreters' interpretations, but when it comes to the interpretation provided by a deaf interpreter, they're much more satisfied with that. Bev speaking. If just to on the topic of data, we at CHS do provide $20 a month to our consumers if they need to use data for their services. So let's say if they have 5 20-minute appointments, we're able to provide through a specific form, a stipend or an allowance almost of data through Canadian Hearing Services. So we do want to make sure that they don't have to take on a lot of that financial responsibility themselves. So on our end, part of us is providing that financial support, but we also do encourage and educate the public to make sure that they either have hardwired internet connections or things of that nature. When it comes to the hospitals, because of the high rate of turnover, that is incredibly difficult because we'll educate one staff member and then they leave and are replaced by somebody else that doesn't know. So even through the pandemic, we're entering our 3rd year now, but there are still challenges and still that need for education. So that's one challenge we face. Answering the question related to deaf interpreters, we have 24 deaf interpreters that are contracted by Canadian Hearing Services, and we have 1 full-time staff deaf interpreter. For emergency services, we do have deaf interpreters available either online or in person, depending on the position. Sometimes if the specific area is too small or if there's a family emergency or a crisis, that could be a challenge. And so we offer them either a mix of both interpreters online, both interpreters in person, or 1 interpreter online and maybe the deaf interpreter in person. So we do have a number of deaf interpreters over the past 6 months who have gone to emergency calls. And just looking at my notes, we have 32 instances of deaf interpreters going to different emergency services. If they're not able to go in person, then they're able to go through technology. Kimberly speaking. Is there an option to have 1 interpreter remote and the deaf interpreter in person? Yes, absolutely. We do encourage the service provider to use their own equipment. Oh, sorry, interpreter misunderstood. Kim was asking, is it possible for the deaf interpreter to bring their own equipment? Beverly speaking, we usually encourage the service providers themselves to use their own equipment. Because our assignment coordinators, our ACs, do encourage individuals to use their own equipment. Again, it depends on the deaf individual. Sometimes they may need to use data, or if the interpreter themselves doesn't mind using their technology, that's an option. One challenge is the screen of an iPhone is so small, so sometimes a laptop with a bigger monitor is more effective. Rich speaking. Yes, for going off what Beverly was saying, we're a bit different at Wavefront. We're actually the opposite. We don't provide data to the consumer. So we're slightly different in that realm. We can provide different technology. It's funded and supported through TELUS, especially during the pandemic over the past 2 years. But it seems that since things have become more normal, that program's been cut. People still do have access to Zoom. And when it comes to deaf interpreters, we do have deaf interpreters through Wavefront Center. They can attend an assignment either in person or through remote services. Hospitals, for example, generally do have monitors ready, but one of the problems is that, or rather, Wavefront does provide interpreting services through an online monitor, but part of the issue is that hospitals don't always have that clearly. And at the same time, some of the content may not necessarily be clearly interpreted or transmitted when it comes to complex surgeries or mental health assignments or things like that. Kim speaking. So now more broadly, interpreters, regardless of hearing level, deaf or hearing, do they have any specialized training for medical settings? Whether that's a doctor or a hospital, do you provide specialized training? Bev, did you want to go for it? Either or. you can go, Rich. Yes, so we do have requirements that all interpreters employed by Wavefront are members of CASLI, and they also do have their own ministry provided screening process. So if they pass that specific screening through MIS, then they're able to interpret in those settings. Great, Bev. We also do have an interpreter screening as part of our system. So if any interpreter wants to be employed with CHS, first they have to graduate through an interpreter training program. That's a requirement. I do know that some quotas are incredibly skilled interpreters, but because they haven't graduated through a formal program, they're not eligible. So that is one downside. But they also do have professional practice. Just going to clarify how I sign, not practices in practicing, but practices in different workshops. So we have a number of different trainings through a learning management system online. Each interpreter is able to go in with their specific user credentials and go in and take a number of workshops. And so we do encourage our interpreters to do that. Sometimes we might have deaf consumers provide a complaint. And so with that, we always give opportunities for the interpreters to have more receptive practice so that they can develop those skills and that they're ready for that level of an assignment. If one interpreter has ongoing issues, we do have some protocols and some requirements that they would then need to take in order to elevate their skills to where they need to be. Rich speaking, yes, we have the same. Rich, yeah. We have the same as well. We do have skills development opportunities. One of the staff interpreters out of the 3 is responsible to make sure that each interpreter meets the requirements for medical interpreting and for professional development. As part of our contract, they do have a number of different hours required, 9 for professional development, specifically for healthcare, and then a number of hours for training for mental health training. And so the interpreters must meet those quotas per year. And that then is done by our association to make sure that all of those trainings are complete. We then also have a review with our interpreters. Sometimes if the interpreter is not sure if they were clear or if they're able to effectively interpret a message, we do have mentorship opportunities so that they're able to develop those skills, and we provide more standardized practice. Interpreter switch. Thanks, Alicia.
Thanks, Timothy. Kim's saying, I'm just making sure that I got everything. I see one question there in the comment, but I'm going to hang on to that question for right now. I have one more in regards to medical interpreting. And after an interpreter has graduated from an ITP, there is further training, certification. Some organizations have certification. Some interpreters may take that through the United States. Here in Canada, there is no certification for deaf interpreters. CASLI is currently working on that. They're working with SLIC to establish a certification for DIs. But my question for you is, how do you do screening for your deaf interpreters to bring them onto your roster? Because the needs in the deaf community are quite in high demand for DIs. So how do we make sure that we're providing for those needs and providing equitable opportunities for those interpreters so that deaf individuals who want to become DIs can become DIs? What kind of training do you require? What are your qualifications and stipulations for DIs, or any suggestions you may have? Makes sense, Bev saying? We do have DI screening through CHS. Currently, that screening is under revision. If a deaf individual wants to become a DI, the first step is to look at the CASLI requirements to become a deaf interpreter. Once following through with all of those requirements, we can also send some resources. There's some information and training through the US for DI, so we can share that resources for anyone who's interested. And then the person can work through that on their own, depending on their interest in becoming an interpreter. So again, that's self-directed study. After all of that is complete, then CHS will offer them a screening. The screening has two different options, or interpreter correction. The screening has two different parts to it. One's receptive, the other one is expressive. And then interpreting those to an ASL interpreter who would then interpret it further into English and vice versa. So that's the type of screening that we have at CHS. However, like I mentioned, it is under review. But if any deaf individual were to contact CHS with interest in becoming a DI, that is the steps that we would refer them to, starting with CASLI. And again, that's self-directed study and motivation to get that DI certificate. A DI qualification, interpreter correction. Rich is explaining, once an interpreter has graduated from an interpreter training program, they're not able to take the MIS right away. They have to wait 4 years before 4 years of community interpreting and experience before taking the MIS, depending, and they have to experience several different types of interpreting. Any members here in BC, Waverley members, interpreter correction, you would have to show that you are a Waverley member here in BC. And after that 4 years of interpreting experience, you can take your MIS, and you, in that case, you could be working with a deaf interpreter at the same time. The DI would then have that same experience. They're expected as well to be interpreting in the community for 4 years and to take the same training. Like Bev said, in the US, there is different types of training. They have CEUs that you have to take a specific number of professional development. And once you've reached the appropriate number of CEUs, you can then obtain that qualification. A DI would work with someone, a seasoned interpreter who's been working in medical environments as a mentor. And once that has been completed and the screening has been completed, we would start with, we have a basic MIS standard. And then as you get more experience, you would increase through the different levels. And the higher up you go would include more complex situations like psychiatry and psychology. First, we would need an interpreter to have the experience and the confidence to work in those environments. Here for training for DIs in BC, there is unfortunately none available. So there has been discussions and how to set up something like that, what's happening across Canada and what's happening in the US, and how to increase our pools of DIs in BC, because unfortunately there is definitely not enough DIs here in BC. Kim saying, I have a question. What was my question? No, sorry, not that question. I have a different question. I want to ask how we can lobby to the government to provide video remote interpreting, regardless of the hospital, whether it be a small rural hospital or a larger hospital, how to get all hospitals to provide that service. Because as many of us have experienced, it's often a runner with the turnover in staff, nurses and doctors. It's not easy to train people on how to use these services. So let me just go back. My position, if say I'm a nurse, I have become comfortable with contacting MIS or whoever it is I have to contact to book an interpreter, set everything up. And I know the different steps that takes, you know, because there are different steps that you have to go through to ensure that services are provided and to have that set up. But if I am leaving that position and someone is replacing me, who offers that training? Because this is then overlooked or not noticed or forgotten about. So here anyways, at our hospitals, we need to provide that education. I know I have seen papers with information, how to book an interpreter through MIS that's posted in the hospitals. I've seen them posted on the walls in hospitals, and I will let the staff know. I just point to the piece of paper to let them know. But I feel like every time I go, there's a new staff and I'm having to explain this over and over again. I'm looking for the person I spoke with last time and I don't see them there. So again, because of the turnaround or the shift change, you're not always working with the same person. So how do we advocate for this? And how do we ensure that this information is being passed on and shared throughout the staff in hospitals so that we don't have to repeat ourselves over and over again? And Bev saying, you're not kidding, Kim, over and over again, 22 years, and I'm still giving the same lecture to the hospitals. They're not taking accountability. I feel like this needs to be perhaps taken on by the Ontario Medical Association or Ontario hospitals, someone higher up, and then work from the top down, because passing on the resources to the frontline workers and then them moving or being replaced is where the information is being lost. So I feel like we are redundant in educating and the deaf consumers themselves. And we're seeing the complaints that they're having to do this over and over again. Hospitals we should have this information posted on hospital websites and accessible, because unfortunately that advocating has to come from the deaf community, not from the service providers, because they won't listen to us as a service provider. It has to come from private deaf individuals. But at the same time, the hospitals do have contracts with interpreting services in the United States. So if there's a VRI interpreter that's provided, there's a good chance that that's not a Canadian interpreter that's interpreting. It's a US interpreter. Perhaps the deaf consumer wants an interpreter from someone local or someone in person, but this is a problem that we're seeing. And they're not being given options. It's take this or leave it. Some hospitals work really great with deaf individuals. There's 134 hospitals in Ontario. So there are a few that work really great with their patients and consumers. There's others that I feel like I'm beating my head against a wall explaining this over and over again. With our learning management system, we have informations and presentations. And Kim's saying, LMS, did you say the learning management system? We have different presentations. And on the LMS, you can see links where individuals can share, the staff can share their information, different accommodation options, suggestions, tips and advice, all of that friendly, helpful information. If anyone wants any information about that, I am working on it right now in the LMS. Please contact me and I can share information. There will be information specific to legal, criminal or police, different types of settings, information specific. And we're always here to provide our best, provide any tips to help improve the situation. Every situation is different, so I can't guarantee it will help your situation, but I highly encourage you to use this resource because there is good information there as well. And it's not easy. Advocating is not easy, but we can't give up. Kim's asking Rich. Rich is explaining. So how it works in BC, if someone is to go to the hospital and the hospital brings out VRI, like Bev said, it's often an American interpreter. If they're ASL, and again, it's regional, so there is a dialect in the language. When you have an American interpreter, that could lead to many misunderstandings when it comes to that different dialect, which I completely understand. We do have a grievance service. One of them is through PLS. PLS is Provincial Language Services, and PLS has a specialized group specific to collecting data from the deaf community regarding complaints on provisions that did not work, or when they requested an interpreter and were turned down. So any complaints that come to us at Wavefront, we share that with the Provincial Language Services, and they follow up and investigate all of those complaints. So again, there is a specialized group that has taken training, and they work throughout the entire province in educating medical professionals in BC on how to use video remote interpreting services, how to book an interpreter, whether that be in person or virtual. And I often work with PLS, and we will often meet to have these conversations and discuss which regions may need it more than others. We do a lot of information sharing. The hospitals now we see setting up VRI, especially if that service is missing. We're slowly finding those hospitals and setting it up. PLS has been working very hard to provide that education and training. They do have some restrictive processes in the hospital, so there is a little bit of navigating that has to happen there before some of these things can actually be established in the hospitals. But there are several different areas that they're working with. Up north, we see a lot happening. Down south, Vancouver, Lower Mainland, we see this being set up even more. Again, weather is always an impact, location's always an impact. So I can't say this is always going to work 100%, but so far we've had a pretty good success rate. I'll continue working with PLS. This is ongoing, just identifying needs, reviewing the services being provided to the community. And PLS is also listening to the community as well, the deaf community. And sometimes people are uncomfortable or embarrassed or don't want to share that information to Wavefront or to the deaf community. In that case, they can go directly to PLS. And they're identifying trends in the community, common frustrations, concerns, and barriers. And PLS then works with us to break down those barriers as best as we can. Kim saying thank you to Beverly and Rich. While you were talking, I remembered the other question I wanted to ask. So going back to associations, Waverley and CASLI requirements, both of you had said the same thing, that there's a requirement to be a CASLI member. Here in BC, for MIS interpreters, all MIS interpreters must be Waverley members, Rich said. And Kim saying, I remember way back when MIS and Wavefront, the interpreter missed the spelling of something else there. It started with a P. All MIS interpreters had to be Waverley members. And the reason for that was because all Waverley interpreters have the title protection. So that was one of the requirements for all of the interpreters to be a Waverley member, so they had that title protection. Say if there were an interpreter from Alberta, our provinces are side by side, and it is possible that interpreters may be working in both provinces. If an interpreter were to come from Alberta and be working in a BC hospital, so if I were to be taken to the hospital, there were no interpreters available from BC, but I knew that there was someone here, an interpreter here from Alberta. I couldn't ask them to interpret for me in the hospital because they're not a Waverley member and they're not covered under protection, title protection. Because I know that the other, unfortunately, BC is the only province that has that title protection. So that's unfortunate, and that's my understanding of how that works. Any other comments, Rich or Bev? And the interpreters will switch.
Interpreter switch. Rich speaking. Yep, there are a number of different things. So first, any interpreter must be a Waverley member in good standing. So that's a crucial requirement. They also do have to demonstrate a portfolio of sorts where they prove their various experiences. And we will have an annual review. Now, understand we do have some interpreters that do work both in Alberta and BC, but they're still a member of Waverley in good standing. Sometimes it could also depend, they might be specifically called, but it depends if they are on that pre-approved list from folks who have done their MIC screening or MIS screening, interpreter, not sure. Thank you. So just one moment for the ASL/LSQ interpreters to switch. And then thank you so much, Bev and Rich. You two can both go off camera now. And so we'll switch to Travis and Wisum from Patient Advisory and CAV. And after that, we'll take a short break. So Travis and Wisum, if you don't mind coming on screen, please. Perfect, and you're both spotlit. Wonderful. Hello to you both. So I'll start with you, Travis. I know that you're currently working as the Deaf Patient Advisor for the Ontario government. Based on our recent conversation with Bev and Rich, is there anything that you'd like to add? Sure. There definitely is a strong need for interpreters. Kim speaking. Travis, can you please tilt your camera down? We can't really see you clearly. Alice speaking. Yes, I agree. Is that better? Yes, thank you. Much better. Perfect. Sorry about that. What one of my concerns is that, one, there's not enough interpreters, but there's also not enough interpreter resources. One is in terms of the court, the interpreter's not sure of that specific sign C. Not sure if that means the court system, but right now, the only LSQ interpreters are available in Sudbury, but that doesn't capture the broad area that we have in all of these different areas, whether it be Sioux, Timmins, or other Northern Ontario provinces. And that one LSQ interpreter is incredibly busy. And so the thing that I am wondering is, how do we support that? And then in terms of access to VRI equipment itself, how do we improve access? Let's say, for example, if there's an older hospital and it has quite strong concrete walls, for example, the Wi-Fi system isn't able to adequately connect to the different devices. So again, that's another place where we, as the advisory board, feel we're at a bit of a crossroads. That's something that requires better development. Wisum, is there anything you'd like to add? Kim? Yes, absolutely. So actually, I have a different question for you, Wisum. Oh, okay. And so this is related to a little bit different just because of your role working with CAV. The questions relating to interpreters who deal with emergency service calls, whether that's through 911 or 988, what's the general year of experience that they would first need in order to interpret a call through 911 or 988? Wisum speaking. Or what are the various trainings that's required? Wisum speaking. On average, the interpreters would have to already have experience for at least 6 years. We do have interpreters with a number of different years under their belt, interpreting in different settings. Specifically for 911 calls, we do have our own internal training resources to make sure that we're able to provide adequate support to those interpreters so that they are ready and equipped to deal with those calls. Anytime a 911 call comes in to a VRS interpreter, it will be flagged on their screen. And so if a specific interpreter on the receiving end does not have enough experience, it will not go to that specific interpreter. A call will only be directed to an interpreter who has already had enough training experience. The same system is in place, like I mentioned at the beginning, with 988 calls. We're working on developing that training as well as various policies so that the interpreters have those same kind of requirements for their training. If an interpreter has already finished the 988, so again, much like with 911 calls, an interpreter won't be able to get a 988 call until they have finished that training. Travis speaking. When you're talking about specific training for 911 calls, I think that's wonderful. Let's say, for example, if I call for a doctor and it's done through VRI, whether it's for a medical appointment or a legal appointment, does that just bring me to any interpreter, or is there any specific screening for those environments as well? Yep, go ahead with him. Wisum speaking. Am I able to answer? Yeah. Okay, I just wanted to make sure. That's a really good point. Right now, we're specifically only talking about 911 and 988 calls because those are designated as emergency calls. Those are incredibly high-risk situations. When we're talking about other topics, those would need specific protocols and guidelines. I know, let's say, for example, legal situations or other fields, those would be interpreters who are responsible to follow their own self-determination around that. If an interpreter doesn't feel confident or equipped to adequately interpret a call or a specific topic of discussion, they are obligated to transfer that call to an interpreter who does have that experience and confidence. Travis speaking. Thank you. Kim speaking. Oh, we are running out of time. I do have one question relating to VRS. If we call through 911 and we end up getting disconnected, what's the problem for that? This can be quite concerning because when we call through VRS, it's usually through an app on our cell phone. So sometimes we've experienced calling 911, but we end up getting disconnected through VRS. Travis speaking. Pause for a moment. It seems that the AFL LSQ interpreter has frozen. Alice speaking. Sorry, everyone. Oh, you can go. Yeah. So I go ahead. Yep. Letty, you can go. Yes, absolutely. That's an incredibly challenging issue when a call is disconnected. Sometimes a patient might be in the ambulance, and just because of the rockiness of the ride or the strength of the signal, people can be disconnected. Absolutely. Normally, in that case, if somebody gets disconnected, the 911 dispatcher will then call that person back, and that's standard practice, regardless if the person is deaf or hearing. At the same time, the interpreter will also try to call the number back. They do have a second system, so there are some safeguards in place to get the interpreter and the 911 dispatcher connected to the interpreter getting together. Kim speaking. Okay, so let's say, for example, if a hearing individual called 911 and they get disconnected, the dispatcher calls back. So that same process applies to VRS. If the call is disconnected, then the VRS interpreter should call back, and the dispatcher also should call back. Great. Wisum speaking. I'd also like to add, there sometimes are issues that pop up. It's not only in terms of the strength of the internet signal. It could be the device itself doesn't work. It could be an issue with a specific version. Sometimes the software on the device might need an update. So there are a number of issues, not just related to the internet signal. Again, if those issues happen, I really encourage individuals to reach out to the appropriate parties, the interpreter missed a specific one, to provide that feedback. Travis speaking. For the issue related to American interpreters working in hospitals, there can be a little bit of an issue in terms of privacy and protecting individuals' privacy rights. Kimberly speaking. What's your question? I'm talking about interpreters in the United States providing interpreting services in Canada. And so I'm wondering, is that a question for Bev to answer? Is that a question for Wisum to answer? Kim speaking. We'll take a break first, and then we can do that. I do see one more question in the chat as well. It says, in BC hospitals, well, actually, for that question, I think we're going to hold that until after the break. I'm sure all of the interpreters do need a bit of a break, just a chance to stretch their leg, get a bit of a drink. I'm sure you all feel the same. So we will be back in 10 minutes. So we'll be back at 1:20 my local time. So back at 1:20 local time. I know everyone is in different time zones, but 1:20 my local time. So we'll see everyone then. Alicia, do you want to pop on the whereby?
Sounds good.
Okay. Just going to wait for our LSQ interpreter to resume on screen. Perfect. Okay, so I think we're ready to resume our discussion. For this portion of the panel, we'll have an open discussion as well as a question and answer period. So if you'd like, you are welcome to either type your question or by using the raise hand function. And so in order to do that, select the raise hand emoji on the bottom of your screen. That will indicate that. And then I will click to spotlight you so that you're visible. We do have a question from Vinu, and that is a question for Rich. So I'm going to ask Rich to come on. So I do see that Vinu had typed in the chat. So one question related to access in British Columbia. So BC hospitals do provide on-demand VRI services using US interpreters. They are not members of Waverley. And so the question is that then an issue in terms of title protection? Rich speaking. Really, we only have a contract with provincial language services. And so they require, they have specific requirements there in terms of VRI in general. I can't answer with that specifically. You would have to contact PLS directly. If they have some kind of an agreement, I'm not aware of those. So it would be best to contact Scott Jeffrey. They're the coordinator there from Provincial Language Services. So I recommend you reach out to them. I'm sorry, I don't have a better answer for you. Emily speaking. Vinu, does that answer your question? Thank you, Rich. Have a question from Alan. From Alan Mason. Alan. Alan speaking. Okay, we can see you clearly now. It was quite bright for a moment. Alan speaking. Am I clear? Can you all see me? Can everyone see me? Okay, good. So I do have a question. When we're talking about medical services, right? So let's say if the doctor during the full appointment, if you don't understand, I don't know, let's say if it's for an eye appointment with an interpreter or have an interpreter on Zoom or VRI, if you're not able to do that, what then can we do? How can we get through the appointment? Kim speaking. So maybe I would ask Cav and Rich, so Wisum and Rich to come, or sorry, Beverly and Rich to come back on screen, please. Kim will take myself off screen for the time being. Wonderful. So my question is for both of you. It doesn't really matter who answers. If I have an appointment with my doctor and I don't have an interpreter and I'm not able to understand my doctor, how then do I contact interpreting services? How do I do that? How do I get an interpreter, either in person or VRI? Bev speaking, just to clarify what you mean. So if the doctor said no interpreter was available, I don't understand your question. Alan speaking, I'll clarify. If I have an appointment and the secretary said, sorry, then only next appointment is 2 months, but I need an appointment now, is it possible to go in medical office and ask for the interpreter's just waiting to understand? If I go to a walk-in or if I have an appointment, how can I contact an interpreter through VRS or VRI through the secretary instead of having to wait for a long time. Beverly speaking. Okay, so you're referring to how to get an interpreter when you have an ongoing issue, whether that's through a walk-in clinic, or if you're in the ER, obviously, if you're in intense pain and you need to see a physician immediately. Generally, the hospital or the client can connect our interpreter booking coordinators. And so the interpreter would go in person or through VRI. If it's an emergency, we also do make sure that the interpreter is available for you in person or through VRI, especially because it's an emergency situation. And so if it's for a regular appointment, you would have to book, but that's completely dependent if an interpreter is available. Some clinics and hospitals already know how to book interpreters, and so they already know how to book interpreters through CHF. Others don't know that yet. In terms of VRS, I can't answer specifically. That would be a question for Wisum because they coordinate that. Rich speaking. It depends. So if you're contacting your service professional because you're in pain, we do have two different options available. The first would be, again, provincial language services here in British Columbia, and they would be able to do that advocacy through HCP, that's your healthcare professional. We would do that advocacy on your behalf. And then there could be sometimes, for example, a cancellation list. So if an interpreter has an appointment that's canceled, we would be able to send an interpreter to you from that originally canceled appointment. If there's a more serious concern, we'd encourage you to go to the hospital, and the hospital does have after-hour on-site, on-call interpreters available, and so they would be able to go. They would provide their interpreter for you for that emergency situation if you were to arrive at a hospital. So those would be the two paths for that. Alan speaking. Okay, thank you. Kimberly speaking. Bev and Rich, if you can take your camera off so that we have space for Wisum. Perfect. I'm happy to explain. It's a really great question you have, Alan. It's important to understand what VRS is actually for and what's within its purview. VRS is a service that's funded. So it's a little bit different in terms of the services for Ontario and British Columbia that Rich and Bev were explaining. They receive funding on a provincial level. Us, on the other hand, receive it through the National Interpreter MIST Interpreter Fund. And so what that means is that it's done through the TSP, the Telecommunication Service Provider. For example, that could be some of the larger phone companies like Bell, TELUS, Rogers. They have a pool of money that is then forwarded to us. And the intention and purpose of VRS is so that deaf individuals and individuals who use ASL are able to make phone calls in the same way that hearing persons can. And so what that means, if you want to call your doctor to book an appointment, or if you want to have an appointment over the phone, you can do that anytime through VRS. It's not just specifically for one doctor. That could be any person, anywhere, anytime, regardless, morning, afternoon, evening, night. You are able to use your device to contact any person through VRS. So let's say, for example, if you have questions or concerns about your medication, about any pain that you have, by using that funding through NCF, that means then you're able to access the person through the phone. And so in terms of specific interpreting services through VRI, that is done through provincial means. And so that could be an interpreter in person, that could be an interpreter through video remote interpreting, but all of that is coordinated on the provincial level, whereas we're on the national level through the NCF. Kim speaking. Wonderful. Thank you so much, Alan, for your question. I'd also like to add a little bit in terms of the NCF. the National Contribution Fund. Originally, before the advent of VRS services in Canada, we did a lot of advocacy with CRTC. They did approve a number of things. The interpreter can't really see Kim's finger spelling clearly. And so the CRTC mandated that those larger phone companies and various service providers, whether that's TELUS, Rogers, Bell, all of those various companies are responsible for pooling funds every year to have funds available to cover VRS and the cost of providing that service. If I remember correctly, Wisum, correct me if I'm wrong, but a budget was just approved for 32 million, around 30 million, yeah. So a budget was approved for $30 million per year. So that is a lot of funds directed to those services. And so what that means is that with the improved budget, we might be able to improve more services and increase more funds in the future. That's kind of the basic idea. With them, I also just want to clarify in terms of the difference between CRTC and NCF. What that means is that it's not specifically for VRS, that's for CAV. And so that includes all of our operating costs as well as all of the programs under our purview. The cost of the program platforms, the cost of the interpreters, because CAV is responsible for paying for those fees, all of our different platforms, all of that is part of that 30 million budget. It's not just designated for VRS services. Right, and that also is responsible for paying Wisum salary, that kind of stuff. Exactly, yes, it is. I'm speaking great, perfect. Okay, so we'll get everybody off screen. We do have 2 more questions from the audience. I see also in the chat. Wisum, so Renita, I need you to hold for a moment. Wisum, if you could come back on screen, please. So I do see a comment that VRS users, sometimes when they're in the hospital, they'll try to use VRS, but the problem is that there's a disconnect because of the hospital firewall. And so how do we circumvent that? How do we get around that? Essentially, people are not able to use VRS in a hospital because of the firewall. And so that's an issue. How do we then solve that? And just one moment, we're switching ASL LSQ interpreters. So in a hospital setting, how are we able to do that? Because hospitals have their various protections and firewalls in place. Wisum speaking. My understanding is that there are 2 different concepts. I'm not sure which applies, but I'll share about both. The first, for example, Connie in this case, if she is using hospital equipment, that is already under the management of the provincial government. So what that means is that in the same way that the federal government has its own firewalls and that individuals can't use foreign apps on their devices, the same applies to people at the provincial level, and that's usually for security and protection. So if you are calling from a hospital device, you should still be able to use your own phone or your own devices. It depends, because if you're using your own device, the hospital's not able to prevent VRS services or different applications on someone else's device. Now for the second question, well, not really the second question, the second concept rather, is if sometimes when you're in the hospital, you enter the space and you're in a particular building, you might be in the basement. Let's say if you're having surgery where you're in an operating room, whatever the case may be. Maybe you're in the archival department or whatever the case may be, that often causes a disconnect for the internet signal. That has nothing to do with video relay services itself. That has to do with internet signals getting to and from the provider to your device. So that's really a tech issue. That's you aren't able to call anybody. That's really not an issue related to VRS. in hearing interpreter switch.
Travis is saying, Kim, can I add something? Oh, go ahead, Travis. I just want to let everyone know that at different hospitals, there may be different contracts. I know in Toronto, they have staff interpreter on site. So depending the stipulation in the contract, I don't know with CHS, I think they have contract with Ontario hospitals. But once you go in, the hospital will tell you that you have to use their interpreter services. That's why sometimes the firewall does cause a barrier depending what the contract says. Thank you so much for that explanation, Wisum, Kim saying. Okay, Renita. Perfect. I've got you on screen. And Renita is saying, I have 3 questions. Who's the first question for Renita? Kim's asking. The first question is for calling VRS, calling 911. I called 911 on November 8th. I was taken to the hospital using an ASL interpreter. The problem was that it was hard for me to see because it was too dark and I wasn't able to sit up. I was laying on the floor and I had to crawl, and because it was so dark, I had to get myself to the door. So I had to use VRS, and in the end, we ended up disconnecting the call after the ambulance came. I had used VRS to contact the ambulance though. The second thing I wanted to say, a few days ago, it was 3 days ago, I went to the hospital. And the hospital already had an iPad. They gave it to me from the hospital with the interpreter ready on it. That was through Saskatchewan Deaf and Hard of Hearing Services. There was a lady from Saskatoon interpreting on the iPad. I didn't have to use my own device. The hospital had an iPad for me to use. The third comment I wanted to make is in relating to what you had said, Kim, about VRI problems and the fact that a lot of the VRI interpreters are from the States, and sometimes there is problems with the technology or the connection where it's freezing or blurry. I don't want that to be Canada's plan for VRI. Do you know if there are going to be any changes? So those are my 3 questions. Kim? Kim's answering. VRI in hospitals has their own equipment. So if you go to the hospital, and Renita's agreeing with that. Yes. And Kim's saying, if you're not satisfied with the VRI service in the hospital, let someone at the hospital know. Okay. Let them know that you're not happy and for what reasons. VRI may not be working for you. Make sure you share that feedback and let the hospital know. The hospital can work with you, whether that be during or after. Again, there's also one of my team that can work with you and make sure that everything's working out in the end. And Renita's saying they had the iPad in the hospital, but it kept freezing. Oh, it kept freezing. It shouldn't be freezing like that. Then it's hard to see what the interpreter says when it's freezing, especially for a doctor or a surgery. And I need to know what he said. And I missed it because it was freezing. So in the end, we had to go back to writing on paper like before. What were you saying, Kim? Kim's saying, Renita, can you touch base with me after this meeting and you and I can talk about this together and make sure that our team helps you. We can go ahead. I can support you in filing a complaint to make sure that we improve those services. And Renita is very appreciative, saying, yes, thank you. Sorry that I brought it up here. And Kim's saying, well, no, I would love to hear more information about this. We'll connect offline. No worries. No apology necessary. And Renita saying, okay, thanks everyone. Bye. Thank you. Kim said, thank you, Renita. See you. Next, we will move to Braden. Braden saying, hello, everyone. Hang on, Braden. Let me spotlight you first. Okay. Hello, everyone. Braden saying. Let me make sure my camera's set up so that you can see me. I have a couple concerns. The first one is in regards to the future and interpreters for medical and mental health, because the number of interpreters is decreasing. And that could be one of the factors on how many interpreters being available. Also, VRS gives us more options. In the interpreters missing the dates to 2010.
So really from the 1990s to the 2000s, there's been a big increase of mainstreaming as well as VRS services. Trying to take it back?
Nope.
Oh, okay. So I think that really some of the reasons for not enough interpreters, one could be VRS services are more common, so more interpreters are working in VRS. And then also in the 90s and 2000s, now a lot more interpreters are working in the school boards because there are more ASL users in mainstream schools. So that's a lot more than 10 years ago. I have an intuition that the rise of VRS and the rise of mainstreaming are going to have a lot of negative impacts on interpreters in healthcare settings, and it's not going to be a good situation for anyone. I mean, even the interpreter believes the person signed in Newfoundland, but even there was just a court case that was decided that the one deaf student had been suffering in the mainstream school with no access to ASL or sign language support. They ended up submitting a human rights claim through the Human Rights Tribunal, and they won. So I think that there are opportunities for deaf persons to become successful with access to interpreters, but what that means is that interpreter missed that finger spelling. But I think there are a lot of impacts on healthcare access to interpreters, and there are more demands for healthcare interpreters as well. I'm speaking, I need you to pause. Braden, continuing. I think because of the systemic issues of mainstream, I think that's
Braden.
Sorry, thank you, Braden. Because of that, I think that the systemic issues, there are going to be a lot of concerns. And so what that means, no, I'm not finished yet. I'm not done, Kim.
But can I just get you to hang on a sec so we can just go through one point at a time? Sorry, I need you to hang on for a sec. So going back to the concerns about mainstream, I completely get that. Your concerns are valid. And I agree with you. From what I've read from the 2016 human rights case, Newfoundland human rights case, there was a submission to the school department to not have to rely on it.
Yes, no, I know.
And the educational assistant knew sign language. So it wasn't to always rely on the interpreter and not to have the educational assistant as the interpreter and helping children in mainstream settings. So just clarifying the role of an interpreter and an EA. Getting back to VRS and VRI. Maybe if we can have Wisum come back on screen. Perfect. Wisum. I know for, I believe it was PAC and CAV. Any interpreter working for VRS must have a balance of community interpreting and VRS interpreting, not solely working for VRS. Wisum's explaining it's not mandatory, it's encouraged to have a balance between community and VRS interpreting, but there is no CAV policy that it has to happen that way. CAV does have the 4 requirements for a VI, video interpreter. But interpreters, CAV does have their, interpreter correction. There are the 4 different companies working under CAV, and they all have their own policies. CAV encourages them to encourage their video interpreters to have a balance between community and VRS work. I would just like to emphasize or reiterate one thing that Braden had said. It was a good point in regards to concerns about the interpreting numbers decreasing. I just want to emphasize, because some of you out there who are watching, I'm not sure if you know of the event for the alternative rep Susan. She was here for the last session and spoke to all of you. If you were able to see Susan's explanation, she emphasized the fact that the area of agency
association, interpreter associations and service providers work together. You got it.
And so they are working together to figure out and navigate that shortage of interpreters. I appreciate your comments, Braden. Kim saying thank you, Wisum.
Do you want to do interpreter switch?
Sure.
Okay. Braden speaking. Okay, but so let's still my concern, and really what I would like to put forward is that we already know with interpreter training programs, there are a limited number of spots in each program. We already don't have enough interpreters graduating from these programs. And so they already need more support to expand the programs because of that limited number of seats. They're already limited in the number of students they can take each year. They're already limited in the number of people who graduate from the program. And so that is another cause of the lack of interpreters providing services specifically in the healthcare field. And so that also is another growing concern. And so I think that really we need to make sure as well that we increase the number of spots available in interpreter training programs. Him speaking. Okay, just to be mindful of time. Well, I have another point. I have one last point. Okay, I thought, well, so we really, this is an open discussion. And so remember last month, we did have the panel on interpreter training process. So wait, please, Braden. So we already did have all of that information there. And so now you're here this month. And so we're not talking about that. This is a different discussion. And so we're going to have another conversation on deafblind interveners and interpreters. That's going to be for next month. This is a 3-part series. So right now, we as a CDGM team are getting all of that information, and we're going to send that to the government and the employers. Braden, okay, great, thank you. But I still have that third point. It's a third concern that I have. Some interpreters are dropping out of Wavely. No, that's a different discussion, Braden. We're not, that is way off course. We're not having that conversation right now. Well, no, but I mean, interpreters are dropping out of Wavely. And so we need to do our part to make sure there are interpreters in healthcare. Kim speaking, that's a little bit off topic. That's not really fully connected to what we're talking about today. Wavely as an association is completely different from Canada Deaf Grassroots Movement. Okay, but we need to make sure that there are enough interpreters. I appreciate that. So thank you for your comments. I'm going to ask Bev and Rich to come back on camera. We do know with the deaf community that sometimes some people are wondering why there's a difference in services between Ontario and British Columbia, and why some services are covered in some provinces but not others. So let's say, for example, dental services, mental health services like a psychologist or a counselor optometrist and ophthalmology and eye exams. Why are some of those not covered? So my understanding is regular eye exams aren't covered by BC. That would be something different unless it's for a specialist, just if I remember that correctly. So maybe, do you, Bev, on behalf of CHS, mind explaining what is covered by CHS and what's not? And then after that, if you don't mind, Rich, on behalf of Wavefront, doing the same. Bev speaking, sure. Really, I felt you were going to ask, so I already wrote this down. We're speaking, me too. What we do is we do have a certain amount of subsidized funds available to subsidize or cover the costs of some interpreting services. So any private practice, so for example, a family doctor, an eye exam, a dental exam, chiropractic services, massage therapy, a number of those are covered if it's related to specific health reasons. Let's say, for example, a car accident. So we do provide coverage for private practices, even for some food-related services like nutritionists and dietitians. We do have subsidized funding for that, depending on the reason. We also do have funding available as well for mental health providers, but again, it depends if it's private or public practice. For us, we would term those in our budget as absorbed costs, and what that means is really that we donate or provide for interpreting services. Other examples of absorbed costs would be a job interview. We don't charge an employer because we don't want to have a negative impact on the deaf individual. So CHS covers job interviews and the cost of interpreting. We also cover interpreting costs for, let's say, family will discussions, funerals. Those are all costs that we absorb. Another alternative is if a deaf individual wants to talk about advocacy for accessibility with members of parliament, we at CHS absorb those costs. CHS has nonprofit and for-profit services. And so how we structure it is that we take the funding from our profit services and we bring that then into our nonprofit sector. For other parts, for example, let's say for a wedding, we do provide coverage for the legal ceremony part, for the exchange of vows. But when it comes to the banquet, we don't. There are some other services, for example, home renovations. Really, there is a kind of an agreement if someone's discussing a contract that we would provide free interpreting costs. For each consumer, if they need for personal reasons, whether it's a vet appointment or if it's something we provide 4 hours per month for free services so that individuals are able to access some services. It's also important to know for lawyers as well, we do provide pro bono services for that as well. Generally, lawyers are not going to absorb those costs. They're going to just push that to their client. The last as well is for various billing. So let's say, for example, if it's an emergency service provider, we would then send those. So we do provide VRI services through police or through hospitals. That itself is a for-fee service. We bill those agencies, but we don't bill the consumer directly. Interpreters who work for us, some of them are freelance, so some might be from Manitoba, Alberta, Saskatchewan, Newfoundland, Nova Scotia, really all across the province. And so they're able to provide video remote interpreting services from their home province as well. We do have a number of contracts as well with various hospitals, police stations, and other service providers like that, so that we already have services ready. Another example would be a contract we have with Bell Canada. I mean, really, we have a number of different contracts. Rich speaking. For medical interpreting services, we follow the British Columbia Services card. It has a list of identified services. And so if a service is listed on that card, then it's covered. For example, that could be private dental services, private eye exams. If it's a lens fitting, some of those would not be covered because that's not included in the BC services card. Some forms of physical therapy might be covered. For example, if it's done in a private practice, we don't cover those services, but if it's provided through a hospital, it is covered. Bev speaking, so that's a bit different from us. Rich speaking, if somebody has a surgery and afterward they have a specific mandate to go to therapy, that would be a covered service. I'm trying to think of other examples. For somebody who takes a driver's license and they're required to have a medical note provided, that's a fee out-of-pocket service. That's not something that's provided or covered by us. That would be something that they would need to pay for interpreting services. So it does seem that we in BC and Ontario are a little bit different in how we structure. We do rely on some grant funding. We do submit a number of applications year after year, but we don't always receive full funding. And so when we do, we'll sometimes funnel those funds into either funeral services or celebration of life. At times, the interpreter also may be willing to do out of goodwill in service with the community. They might be willing to provide pro bono services at their individual discretion. So for individuals in British Columbia, I'd encourage you to look at the BC service card. It clearly identifies where interpreting services are provided and where they're not. There could also be some areas for advocacy. So let's say, for example, if an individual requires communication to clearly diagnose whether or not they need a dentist or a dental appointment, that would be an area where they could lodge complaints. And if there are sufficient complaints, that might be an opportunity to add that kind of a service. It could be done through medical interpreting, but really it's all related to that BC services card. Kim speaking. Okay, so it's a little bit different how each has their own. Related to the federal government, they do divvy various funds for each province's own healthcare and service providers. So that's why there's a difference. It's because it's dependent on how the province uses the funds. So it's interesting that what British Columbia has, Ontario doesn't, and vice versa. Rich speaking. Also, if I could just add, we know Ontario has already developed the Accessibility for Ontarians with Disabilities Act, originally known as the Ontario with Disabilities Act. And so through that, there's a number of services that have already had time to become more accessible. We in BC, we're still in its infancy. It's just in those initial stages. And so there hasn't been that time for incremental systemic change. Hopefully, we'll be on par with Ontario in the future. Who knows? We're still working on it through the BC Accessibility Act, but it's still in its infancy, so I can't really say for sure. Kim speaking. I do see one more question. Travis, I see there. Did you want to comment? I'm going to take myself off here, bro. Travis speaking. Okay, so this is a question for Bev. So should I go off? No, Bev. So this is a question for you specifically. So just to make sure, so I have two questions. The first is those 4 hours of personal use. Let's say if I go to a family event once a month, does that mean that I could use interpreters for that? Bev speaking, you have up to 4 hours per month. And so you contact our assignment coordinators and they will then let you know. Now, it depends. Some of the appointments actually do have costs associated. Sometimes it might be subsidized, but you contact Canadian Hearing Services, we will record that. And we can also add a note on your file. So we have a client management system that records all of the services. And so some deaf individuals, let's say if they have a preferred interpreter, we record that as a private note on their file. It's not public, all of that's confidential information. But again, the same practice would apply for those free service hours. We record how many hours you've used. Let's say if you've used 3 and you have 1 more, but we record that in our internal system. Travis speaking, that's awesome. One person also did type in the chat, how many interpreters are working in Ontario for CHS and for CAV? That would be interesting to know. So maybe we can get Wisum to come back up later. I'll interpret this turn from Bev and then switch. So we do have a number of different interpreters. We have 30 staff interpreters and the remaining number are freelance. So what that means is that freelance interpreters are not always committed to providing services through CHS. It's dependent on what their schedule is. Our freelance interpreters are incredibly gracious in providing their time, but they do also have other commitments. So it's a good balance for both. Sometimes if deaf individuals prefer a specific interpreter, they already know and are willing to make availability for that specific consumer. So we have around 225 interpreters altogether. Interpreter switch.
Travis said, thank you, Bev. Bev's asking, so am I turning my camera off now? Kim said, yes, please. Wisum, can you come back on screen? We're figuring out the spotlight. Okay, I got it. Now, Wisum, if you can answer the question, how many interpreters work for CAB? CAV has 4 different types of service provision. Among all 4, there is a total of over 325 video interpreters working for CAV. Oh, wow, okay. In that number, 325, 75% of those interpreters are ASL interpreters. The other 25% are LSQ. All of this information is included on the CAV website. If you want more information or if you would like these numbers, you can find all of that on the website. And Kim saying, can you talk more about the 4 different types of interpreting? 4 different types of VI provision services. So ASL, there is Convo, there is SLEO, providing the ASL interpreting services. For LSQ, there is Civet, the interpreter's not sure how to pronounce it, SIVET, as well as, did you catch the last one, Timothy?
No, sorry.
Yeah. 4 different service providers and providing services for video relay interpreting. So among those 4 different companies, there are 325 total interpreters. Great, thank you, Wisum. I don't think I see any other questions for you. You can go off camera. I don't see any further questions. So now that we've got to delve into this discussion, questions about virtual interpreting, medical interpreting, emergencies, advocacy within the deaf community, I did want to share that a few years ago, and I'm not sure if this is going to work out, but I wanted to share about a situation that had happened to me. And it was pertaining to exactly what this woman had warned me about that helped me understand, and I'm hoping to share this information and enlighten you as well in regards to emergency services. For emergency services, a deaf person might not be in the right state of mind. If they're panicked or emergency, they may not be coherent. They may be in an enormous amount of pain. The situation could be quite dire or critical. In that situation, it's not easy to have the capacity to try and find an interpreter on your own. So in that case, you can ask the hospital. There's a social worker on site at the hospital. Ask for that individual. Can I speak to the social worker on site? Let the social worker know that I'm not in the capacity to contact the interpreting company on my own. Can you please contact, for example, Wavefront's MIS services? And the social worker will do all of that on your behalf. Don't ask the doctor, ask the social worker, and they'll do their job. Their responsibility is to do that advocacy. So someone shared that with me. I wanted to pass that tip on to you. If you end up for emergency services being brought to the hospital, not able to do that advocacy on your own, or try and contact someone to get an interpreter at the hospital with you, or if you're struggling, ask for the social worker. The social worker will offer that support. Let them know that you're deaf. Communicate with them about what your needs are, and they will reach out and book that service for you. Travis, I see your camera on. Thank you for that, Kim. Again, speaking on behalf of Ontario Health Advisor. Ontario, depending on which hospital or which clinic you're going to, there is patient advocacy for patients at the hospital. So if you happen to be in the emergency room, in the waiting room, and you have concerns, again, this depends where you're going, because this is not the standard throughout Ontario. There is an advocate to do that work for you. You can ask them to make those connections, to find the interpreters, to get the support that you need, whatever it is that you need in the hospital. Recently, there was someone who had gone to the hospital. They needed an interpreter. They had signed the form asking for an ASL interpreter. If you get pushback from the hospital, most times there is information there to contact an interpreter. CHS, for example, their information is often there. They're registered with the hospitals. The only problem is that staff turnover. So having to train the new staff, or perhaps staff that have forgotten or have yet to be trained. We have to be patient in working with those individuals. If those problems persist, I think it's OIS Emergency Services that can help negotiate those situations for you. Bev, can you speak to this? Kim's asking. Bev's explaining. Travis, you're correct. Before, the old Ontario Interpreting Services is now CHS, Interpreting Services. We do offer different types of translation services, but you are correct. For emergency services, you can explain to the hospital staff, like that deaf individual did in the hospital. You can use text to emergency services. I'm sick, I'm in the hospital, I need an interpreter. At that time, it's imperative that you share the phone number for the hospital so the emergency services can contact the hospital and set up those arrangements. Sometimes you have that information, sometimes you don't, depending where you are. If you are in
Patient care.
Thank you, Timothy. Depending on your experience, sometimes everything's different. There's beautiful names for all of these different departments and different roles. I would encourage the deaf individual that once they arrive at the hospital, ask to see patient care. And do that immediately once you arrive to the hospital. I would encourage all deaf patients to do that, especially if the interpreter has not arrived yet, so that the interpreter can be ready. They do have a list of interpreters ready to contact and provide that service. So just type that out on your cell phone, have it ready to show them, and they can contact the interpreting services. Sometimes you're being brought to the hospital via ambulance services. Here in Ontario, the ambulance drivers will not book the interpreter. Their role is to get you to the hospital safely, and then the hospital takes that onus on of booking the interpreter. It's very nice that we do have VRS as one temporary solution for this, from getting to your home to the hospital. In Ontario, we have these. Rich is saying, yeah, we have that too. This is from, explains about the Eldridge case, printed out and ready. It has it in French as well for LSQ and French users, also in English. You show that to the staff at the hospital. And if it's still insufficient, there will be, it's coming soon, May for Mayfest. There will be an article, it's about the size of, or not an interpreter correction, a document about the size of a receipt, explaining why someone might need a sign language interpreter, because there are a lot of hearing people that just don't know. So if we have that documented, explaining, I don't use oral, I can't read lips, or however that might be, this is the type of support that I need, and have that all listed out. And then you just show the hospital, and CHS's information would be at the bottom of that document. So everything that you would need is there. It's essentially saying, I'm deaf, I need an interpreter. Please contact this number to get an emergency interpreter. So we don't quite have that ready. It is just in the works. once we have that ready, and we'll include, of course, video services as well, that will be a resource available to the deaf community. Rich is asking, can I just add something? Here in BC, we encourage individuals for emergency services specifically to have ready on their phone, perhaps if you are in a state where you're not able to communicate due to those emergency services, that information there and ready. I'm deaf, I need an interpreter, and you can just show the phone to the doctor, the hospital staff, the ambulance, letting them know. And all of that information is ready on your phone for you. Contact information is right there as well. I know sometimes as well, individuals use the key tag, like the other one that you had showed. Here in BC, we have a similar type key tag that we use, but I often do see people using that same information accessed through their cell phone. Working as manager for Wavefront, I also have a second hat working as a social worker in hospitals, and you can request that the doctor put down electronically that information that I'm deaf, I require access via sign language interpreter. So ask your doctor to make note of that in their system. It's also a good opportunity to review the history in their system, make sure that your information states that you're deaf and need an interpreter. I don't know if it's the same out east as it is here in BC, but let your family doctor know. Ask them to make note of that. When you go to make an appointment at the front desk, follow up, double check. When they review your medical history, make sure all of that's there, and make sure that they have it noted that you have to call an interpreter first and share all the information about the appointment with them before confirming that appointment, so that when you're calling me as the deaf consumer, you're calling me with the access set up and ready. So this is something we are trying to educate our community about. And Wisum saying, beautiful. Thank you for both of those replies. I'd just like to add something as well. Thank you, Bev. Bev had mentioned about in regards to the ambulance not contacting the interpreting services to book an interpreter. I just wanted to add that while someone has a VRS interpreter online through 911, you can also use that VRS service to contact an interpreter, whether that be first responders, ambulance, police. You can ask them for the first responder's phone number and then pass that phone number on to the VRS interpreter, and that interpreter can contact the first responder directly. But again, letting them know that you need that interpreter. If it's 911, that happens automatically, and it is routed through a video interpreter who is already trained to interpret 911 or emergency calls. So that means that you would be responsible to let the interpreter know this is an emergency, please transfer me to an interpreter who has that training. And then once you get to the location that you're at, you can work on getting an in-person interpreter from there. One experience I'd like to share is from this past summer with CAV, using a sign language interpreter through a VRS interpreter on the ambulance, and the whole way from the house to the hospital. It was very accessible. If you want any further information specific to VRS and 911, please feel free to put those comments on. There are videos by Suzanne in ASL and LSQ. You can watch all of that on our website. And Rich is saying for funding for ambulance and hospital is separate funding here in BC. Ambulance have their own private contract. It's not under the hospitals. So that's why when it comes to accessing medical history, they're on completely separate systems. So if you ask someone on an ambulance, they won't have access to that information. They are providing a service from point A to point B. Once you get to the hospital, at the hospital, they will have access to all of that medical history. But on the ambulance, they don't have that same information. So I just want to make sure that everyone understands the difference between the two. Travis is saying, I'd also like to add here in Ontario, and this is something relatively new, with the green health card, where you would swipe it and then the file comes up. The way it looks now is if you have an appointment or if you're visiting the hospital in Ontario, if you need to make any changes for specific to accommodations, if you have not shared that information with your healthcare professional yet, you have the option to use that tag. You have the option to have them contact an interpreter.
Oh, can I jump in, Alicia?
Yes, please. Yes, please.
So in terms of that system, we're in the process of setting it up. We haven't set it up yet. One of the challenges was that we are planning on having it accessible, but it's not yet in place. So that way, even if you are knocked unconscious in a particular accident, even once that card is swiped, then they will already know to have an interpreter there. Again, we don't have that service in place yet, but it is a work in process. Just wondering, Rich, do you have any kind of similar thing? So again, just to summarize, we're having an accommodation system in place in the future so that once you swipe the card, we'll be able to have that information available, but it's still a work in progress. Interpreter missed if BC has that or not. Kim speaking, just one moment. We're just going to switch interpreters. And Alicia, it was time to switch anyway.
Thank you for that support.
No problem. That's the team. Kim speaking. I see we have 3 hands up. We have Denise. So Denise, if you can go. Hi, everyone. I'd just like to introduce myself. My name is Denise Caldwell. And I'd like to share a bit about my experiences with patient support, specifically for people who have had a stroke. Interpreter does not know. When using Wi-Fi, there can be a lot of challenges in the hospital because the system is so weak. And so I think maybe a point for advocacy could be asking hospitals to increase their Wi-Fi services. However, when the patient transferred to a different Wi-Fi system or a different hospital, the challenge was that the building was so old, it actually made it difficult for the Wi-Fi to navigate. There was a lot of freezing in the video stream, and so the hearing hospital staff contacted a social worker that was under the patient care department. I then explained to the social worker that for accessibility, especially for the patient in severe medical conditions like this, when the person had a stroke, they really needed somebody, and they would need to have somebody with them who has full access to a high-speed internet connection. So really, I think the point is that there needs to be a better hospital system and buildings. Some of them have updated technology, but some of the technology is still weak and quite outdated. And so what happened was that the social worker said that the hospital had to increase its Wi-Fi system. And so I did just want to share that the social workers do have a lot more power than the hospitals themselves. And so that's maybe one strategy to increase access. Somebody speaking, thank you for sharing. Denise speaking. It's important for more exposure to the community for sure, because a lot of people don't have any idea about deaf individuals or what working with a deaf patient would look like. So I just wanted to share that. In speaking, okay, we'll go on to the next question now. Now to Amy Crichton. Hi, everybody. I do want to share about 2 different experiences. Sorry, I got a little bit confused for a moment. I wanted to share 2 things. One is a new hospital in GP. Interpreter's not sure if that's a general practitioner or if that's a city, but it will be opening on December 4th. And so that new hospital will have VRI technology available. Do you think they would? In speaking, they should. They should have that already. What I would suggest is you contact the Alberta government and you ask them. I'd encourage you to reach out as well to the Alberta Association of the Deaf, because they'll help with engaging in some of that advocacy so that the GP hospital will be able to set up those different services. So I'd encourage you to go to the Health Department or Ministry of Health with the Alberta government, because that way you can also get the Alberta Association of the Deaf to contact you. Yeah, no, it just opened already. So thank you, Grand Prairie. So the hospital in Grand Prairie. Okay, and then did you have another question? Yes, I'm wondering in terms of using the phone to access an interpreter, I don't really know a lot about that. So how does one set that up? So you mean your phone is not working to access an interpreter? Yes, I don't know how to set it up. In speaking, you can see me afterwards and we can set that up as well. So what we can do is we'll work with CAB to make sure you get video relay service set up on your phone. Okay, great, thank you very much. And sorry, did I see you had a third question? Nope, it was just the two. Perfect, okay. And again, so Amy, you just contact me afterwards and then we can sort that out. Thank you, Amy. And I'll pass it to Alan, please. I do have a question. It's come up after taking in all of the discussion. I'm wondering if I am using my phone for different services, what happens, for example, if somebody's nosy and wants to access my information? So that's one concern. Then as well, I can show you an example. So I have this card here. It says I'm deaf. I cannot lip read. I'm speaking. Hold it up closer to the camera. It says I am deaf and I can't lip read. Okay. Yes, so I have that card because sometimes when I'm typing, I don't know. I just think some people might take advantage of using my phone. They might get into that private information. So that's a concern. Kimberly speaking. Yep, Rich. Well, so normally, at least for myself, so I can just show you here. I just type it like this in the notes. That's all, simple. There's no personal information here. I just open this specific notes app on my phone. That's the best. Oh, that's so clear. Okay, thank you. Thank you so much. Rich speaking. Also, just Alan. I just wanted to add as well. They don't know your password or they don't need anything to get in your phone either. There's one app that's called Health. The interpreter's not sure of the English name, that has limited access to information. And so what you can do is by clicking that app icon, it will just show what your name is. It will show if you have any immediate medical concerns like high blood pressure or diabetes, but they can't actually go into your private information. They can't see your different apps. They can't see any of your history. They can't see any of your files. It just allows them to see the relevant healthcare information. So you yourself add your medication and your medical history, and just that allows them to understand who you are as a patient. Sometimes people might not have ID, they might not have an actual hard copy, and so people instead bring their phone. As well, if other individuals, they might be deaf plus, and so what that means is that they know that they have their phone with them at all times. It's much more difficult to lose than a wallet. And so that way the person can see their name, their birth date, whether or not they have diabetes or any other health conditions. It also shows that they're deaf, and that's much more effective for them to go to the hospital. So just to clarify, that health app doesn't have any banking information, that doesn't have any private information, it doesn't show your PIN, it doesn't show your passwords. There's no way to circumvent that. There's no way to get around that. Alan speaking. Do you mind what's the name of the app specifically, or what's the website? I'd recommend going through Samsung. I don't know specifically. iPhone has one already. It's just called the Health app. It's just in there from the factory settings. So if you'd like to share any of that information, you click the app. It will ask what information you want to share. You then say yes, and it's just limited information. Him speaking, yes, it's called your healthcare. So it shows about your healthcare, your age, your personal health history, if you're diabetic or not. And you can look Rich is showing an example. So for the app, you select it, you choose the name, you say what information you want to share. It will ask you, you click yes. If you don't say yes, then no one is able to see it. So you have to authorize it. It's important if you feel comfortable sharing that information. Really, it's not a lot of information, but it's easier to be able to quickly access your health records. Then when the person in the hospital is able to take that information, they're able to access your full ministry record and make sure everything lines up. Great, thanks. That's really, really helpful. I'm gonna go off now. Alan speaking, thanks. Him speaking. If Bev just wanted to add something in terms of the hospital. Bev speaking. Oftentimes deaf individuals don't realize, depending on the hospital name, you can actually check what their accessibility services look like. They generally on their own websites would have accessibility services there. And it also shows that they have a commitment to providing a sign language interpreter. They have that information ready. And so I'd recommend you take a snapshot because I, for example, have a hospital close to my house. If I need and there's any pushback, I can show that it's on their own website and that stops them right in their tracks. There's no argument. So I'd encourage you to check the website for your local hospital, click the accessibility tab or accessibility page and take a snapshot that it says in black and white that they have a commitment to providing interpreting services. Keep that in your album on your phone so that as soon as you arrive to a hospital, if anyone has any issues, you can show them that screenshot, and you can also have an interpreter's contact information, so there's no argument. My husband does the same, but again, we're old in that way. We just have it ready. And so again, I'd really encourage you to look at their website. If they don't have any accessibility page, well, obviously that hospital as an institution is not committed to accessibility. And so then that's even an opportunity to check and say, I noticed you don't have any accessibility page, or I've noticed you have a fantastic accessibility page, and you can use that to either encourage them to continue what they're doing or encourage them to change. So I'd really encourage you all to do that research yourself. And again, if there are any issues, you can contact either the patient care or patient care experience office just to share that. Wisum speaking. Absolutely. It's really not to add on to this discussion. It's more so going back to what Amy was talking about. It seems that Amy was struggling getting access to VRS on their phone. I'd really encourage you, Amy, if you contact, if you visit the CAV website, have VRS, it shows on the bottom, there's actually a small icon with the chat. It's an automatic chat so that you can have a discussion with the team and share what your concerns are. Either you aren't able to get access on your phone, you can share if you're trying to get the app on a phone or a mobile device or a computer, share the specifics of the device itself, and a staff person will lead you through the process so that you can set everything up correctly, that you can get your number registered and everything of that nature. Kim speaking. Great, okay. I see Melissa says, do we have to download the Health Info app? For an iPhone, I have an iPhone. It's automatically included as part of the factory apps. Everything is there ready. You yourself are responsible for putting in your personal health information. Now, in terms of other devices, whether that's Android or Samsung, I'm really not sure. I can't speak to that. Wisum has disappeared. An interpreter switch.
I'm saying perfect. Sorry, Wisum, about that. Wisum speaking. For myself, I use a Samsung. I've used Android for the past 6 years. I had to download the health app and install that on my own. Aside, the iPhone has it there automatically. The Samsung does need to be downloaded. And like Rich was saying, you don't need a PIN to access that information. It's as simple as a click of an app. Kim saying, that's right. Same with mine. I don't need a PIN. I just click on the app and it shares my health information. Rich, I saw you come on there. Did you want to make a, sorry, hang on there. Good to go. And Rich is saying, I just want to clarify that I'm not saying you have to download this app. This is a personal choice. If you want to have that information on your phone accessible for health professionals, that is up to you, but you don't have to download it. It's nice because when you get to the hospital, you've got all of the information at your fingertips. I would encourage you to download it, but I just want to clarify that this is not mandatory. This is completely up to you. Kim saying, if it was me, I like having everything ready, good to go, getting to the hospital and just showing them my phone and not having to figure that all out in the moment. But thank you for that advice there, Rich. Renita has a question. Renita, if you can come online, come on screen. Renita saying, I have two things. First of all, physical medical alert, like the necklace, like I have here. Deaf, and did you catch the second one there, Timothy? And making note of that.
No, sorry, diabetic.
Diabetes as well. I have this diabetic alert bracelet. I like to use those, then it's easy to show an ambulance driver. But in Saskatchewan, I get criticized a lot for using the...
Discriminated against for using sign languages.
Thank you.
No problem.
And I don't appreciate that about the Saskatchewan hospitals. I'm not sure if it's the same across other provinces. In Nova Scotia and out east, I didn't have those same problems with the ambulance. Kimberly's...
Sorry, just an interpreter clarification. I'm criticized by the deaf community because the sign I use for hospital is different. I sign it with the kind of U on my forehead, but others are doing those different ones you're showing, Kim. Sorry, yeah, I misunderstood that the first time.
Thank you.
No problem.
Kim's just saying, you're right, Renita. They're called regional signs, depending where you are. If that's your sign for hospital, that's fine. If someone else uses sick house for hospital, that's fine. Someone uses the H on the shoulder, that's fine. Everyone uses their own sign for hospital. And Renita's saying, well, out east, it's a different sign. Oh, yes, thank you, Kim, saying you're right. Okay, I don't mean to criticize Nova Scotia Sign Language. That's not what I mean. No, that's okay, Kim saying. We're learning. That's great. Okay, Renita saying, okay, thank you. Bye, thank you. Renita's right. There are different regional signs across Canada. So we do see several different signs for hospital. And that's completely normal, depending if you're Western Canada, Eastern Canada. I see Melissa Whalen has a question. Hello, Melissa saying, just a sec, Kim saying, okay, I've got you up on screen. Melissa saying, hello, I'm here, I'm from Alberta. This is my first time with this kind of Zoom meeting. So it's something new for me. I haven't actually accessed an interpreter for a long time. For the most part, I use my sister to help me when I need sign language at the doctor or the hospital or anything. So my sister supports me no matter what happens to me. If I did set up VRS on my phone, but I still struggle with it. So that's an ongoing battle. I'll continue getting that figured out. And look forward to having that being set up for Alberta. But for the time being, I'll contact my sister. She does and socialize with the deaf people here out in Alberta. Kim saying, whereabouts are you in Alberta? I'm in Fort McMurray, Melissa said. Oh, up north, Kim saying, yeah, up north. And Kim saying, I can connect you to the Deaf Association in Edmonton, EAD, if you'd like, and make sure that you have access up in Fort McMurray as well. Yes, please, Melissa saying. And Kim saying, just a caveat for everyone, not just you, Melissa, this is for everyone. I know sometimes there's no interpreter available, so we might rely on a relative, a sister, or a parent. I'd highly advise against that. The reason for that is when you have a family member interpreting for you, are they able to interpret accurately all of the information? Often not. And just, sorry, hang on, let me finish explaining, Melissa. And so if you have a family member or whoever it is that you have there interpreting for you in that situation, so pretend I'm your sister. I'm just making this up, but pretend I'm your sister. As I'm interpreting, I'm thinking about what's going on with my sister. I'm going to have emotions attached to it. And once I have those emotions attached to it, my mind's not thinking clearly. So am I able to give you that information accurately, what the doctor's saying when I've got emotions tied to it? Often not. So this is why it's important to bring in a professional or qualified interpreter. It's nice to have a family member present with you to support you through whatever medical needs you might be going through, making decisions and having that conversation with the doctor. Maybe the doctor tells you that you need to have heart surgery, you need to get a pacemaker put in, or maybe I'm just making this up. Maybe the doctor says that, oh, one of the flaps on your valve on your heart, the blood's flowing through and the flap needs to be replaced, or you need surgery. So we're going to take a flap from a pig heart. And if your sister's interpreting that, she's going to have feelings that come along with that. And Melissa's saying, yeah, you're right. That's a different situation. And Kim's saying, so an interpreter would be able to give you that information from a neutral perspective without the emotions tied to it. So have that family member there as a support person that you can have that conversation. Oh, gross. They're going to give me a piece from a pig heart and I'd rather have a different pacemaker, or have that conversation with your family member, but at the same time, have a professional interpreter present to do that interpreting. So I would highly advise not to rely on family members or CODA children to interpret for you for that reason. And sometimes the hospitals will tell you, oh, that's fine. Your family can interpret for you. You let the hospital know that, no, that's not fine. Take a stand and let them know that you need a professional qualified interpreter in that setting. Looks like Travis wants to say something. In Ontario, it is forbidden, illegal to have family members interpret for you in medical settings. Also, if you speak foreign language, same situation, you're not allowed to have family interpreting for you. Like Kim said, there's emotions involved, maybe a conversation of death comes up, and that's hard to interpret. So it is not allowed here in Ontario. Some people don't follow that rule, but technically it's not allowed. Melissa saying, okay, thank you. Kim saying, thank you, Melissa. And Melissa's thanking everyone for the information. That was very helpful. Take care. I missed the beginning of that.
And also, I just do see in the chat, we're talking about whether or not it's possible to change the earning rate for interpreters in person versus VRS. For example, most VRS interpreters feel comfortable to be able to work from home. So maybe if they earn a little bit less compared to an in-person interpreter, and that maybe could be a motivation for them to go and work more in person instead of just VRS.
And Travis is adding, just before that comment, in regards to hospitals and their policy for interpreters, whether that be in person or if someone chooses to use their phone. For X-ray, MRI, and CT scans, the interpreter has to be in person. The reason for that is because that equipment, especially MRI, can destroy one's phone. That's correct, Kim. They're heavily protected, Travis is explaining. So you cannot use a phone in those rooms. So I just want to let you know, if you think you'll be going to the hospital for an X-ray, make sure that you book an in-person interpreter for that appointment. Bev, do you want to say more about that? Kim's saying, Bev, go ahead. Beverly's saying, so there was two different questions, right? First of all was in regards to pay rate, and then Travis was talking about MRIs. Which one am I speaking to? Kim's saying, if you could talk about interpreters working from home and pay rate potentially earning less than interpreters working out in the community, how does that work with CHS? And Bev saying, we don't distinguish. Our pay rates are based on COI. If you have taken the certificate of interpretation test, then there is a higher rate of pay. But aside from that, our pay is the same regardless of if it's a virtual appointment or in-person appointment. I know agencies all work different in how their pay rates work and how they pay their interpreters. So even with VRS, it's quite different than what we see at CHS. There's government interpreter bookings as well. So all of that is different. There is no standard. It's quite various as to what you'll see for interpreting rates. With freelance interpreters, I know you can often negotiate a rate and work out with them. I don't know what rates freelance interpreters work out. And I know deaf individuals often don't know what the interpreter is being paid as well. Although some deaf people want to know how much the interpreter is getting paid to attend a meeting or to interpret for a meeting, but typically that information is not shared with the deaf consumer. So again, different agencies, different rates of pay, even province-wise, all the rates are different. Government contracts all have different rates. So there is it's impossible to standardize the rates really. The other question about MRI, surgery, so on and so forth. At CHS, we do encourage those bookings to be in person. We're aware that there are some situations that require the interpreter to be there in person. However, there may be a situation where it's quite remote and an interpreter can't get there. In that situation, we may have the doctor talk to the patient before they enter the MRI, CT scan, wherever they're headed. All of that information be interpreted outside of the room, and then the interpreter would wait or disconnect while the MRI or procedure is done, because some situations it's impossible to get an in-person interpreter there for the appointment. And another thing is, if you're requesting a male interpreter, the percentage of male interpreters on most agency rosters is quite few. So again, just having the doctor explain to the doctor the situation ahead of time so that they can explain to their patient before the procedure's done, put everything on hold, have all of that done, have the interpreter ready so that can be interpreted. And again, sometimes a deaf consumer may prefer a male interpreter, and that can't always be promised as well. So there are some different workarounds for those types of situations. Kim saying, I have a question for the two of you in regards to interpreters. If it's a situation, perhaps a surgery where the interpreter needs to be there in person and you're meeting with the doctor for a pre-op, gathering all of that information, what are going through all of the expectations in regards to, am I going to be put asleep or what will be happening? Of course, there would be an interpreter present for that pre-op before the actual surgery or operation. Sometimes if during the operation, the deaf consumer is going to be out the whole time, then an interpreter may not be needed, or the interpreter may be out in another room or rely on VRI for after the procedure to interpret the situation. For your agencies, would you have an interpreter go and stay at the hospital all day? Sometimes it's a 5-hour procedure or an all-day procedure. Maybe a deaf person prefers to have a specific interpreter there with them, depending on the situation. And maybe they want to have a consistent interpreter throughout all of their appointments related to that specific situation. So the interpreter is aware of that information. Is that an option? And Beverly's saying that is an option. If you want to have a consistent interpreter at CHS, we'll book an interpreter at the hospital for 8 hours, and that interpreter will sit and be available for to interpret when needed. We do also follow consumer preference. If the interpreter, maybe their preferred interpreter is only available for 6 hours, we will negotiate with them and let them know that they're only available for 6 hours. Some things that are more unpredictable, like the birth of a child, it depends on the interpreter's availability and if they're able to stay for the duration that it's needed. Maybe a situation where a person has cancer and they're going to the hospital regularly, we might encourage them to have a list of 2 or 3 preferred interpreters as opposed to just one, so that if that one's not available, there are some other options. So we do work with the deaf people, and I mean, it's a lot of work. It's quite frankly, it's exhausting for the coordinator as well as the deaf person, gathering all of that information and making sure the right interpreter is there when needed.
Interpreter switch.
Perfect, thanks.
Also, it depends on the region in which the deaf individual lives. Some areas have fewer interpreters available, and so it can be quite difficult to coordinate, especially when there are interpreter preferences. Let's say, for example, in terms of more northern remote areas, think of all of the various appointments a deaf person goes to in a day, and if all of them have the same preferred interpreter, it will be almost impossible to have everybody get the interpreter that they'd like. So sometimes there is a little bit of work that goes into it for things like cancer or chemotherapy, radiation and things like that. We will try our best. The interpreter missed the finger spelling of that last term, but depending on the nature of the appointment, we will try to have a roster of interpreters. Also, if it's an ongoing appointment, we'll try to have one recurring interpreter all the way, just to make it consistent. And for those days when they're not available, then we will have them switch as well. I'm speaking. This will be our final question. Is from Amy. So Amy, just one moment. Yep, I'm here, Amy. I see you. Yes, so I absolutely agree with what Kim and Travis had both said, because oftentimes for example, one time I did end up
Moved to Grand Prairie.
I did move to Grand Prairie. And so I originally did live in a smaller town before moving here. And so that can cause a lot of trouble in terms of trying to navigate. Kim speaking. We're almost out of time, but so how about we have a conversation offline after? Okay, we'll talk a little bit more. So you can absolutely be as assertive and an advocate as you want in that conversation, but we'll hold that just until after. Okay, thank you so much. Kim speaking. Okay, I think we are going to do our wrap up. I'm just looking, I don't see any more questions. So we are able to wrap up. Wonderful. I would like to say many, many thanks to all of our panelists who were involved today. They gave up their time on a Sunday of all days. Some of them it's the afternoon, some it's the evening, depending. But regardless, I'd like to say thank you to Wisum, to Bev, to Rich. Come on camera, everybody. Let's get all of our panelists on camera. Can everyone see us? Yeah. So many, many thanks to all 4 of you for joining our presentation today and for joining our panel discussion. It was such wonderful information. I think for a lot of us, you're filling in a lot of gaps. So thank you so much. I'd also like to say thank you to everyone who asked questions and engaged in the discussion. Thank you everyone for your time and attention listening to the conversation. So we're all a bit more informed about interpreting access connected to our healthcare. Really, it is an ongoing discussion, and so we'll continue to do that work of advocacy and collaboration so that we can make sure all of our different communities and us as a larger deaf community have access to interpreter services. Some people think that interpreters really are nothing, but they are our lifeline. They are really one of our accessibility tools, and so we need to make sure we have access to them. Does anyone have anything that they'd like to add? Wisum speaking. I'd also like to say thank you to Canada Deaf Grassroots Movement for hosting this webinar. Thank you all to your audience, and thank you as well for the invitation that you extended to CAV to join. Really, there's a lot of important information that we've been sharing today and a chance to come together and understand everybody's different perspectives and approaches. So thank you as well, CDGM, for your work. Bev, thank you so much. I mean, really learning so much through what CDGM is doing. The work that you're doing is incredibly worthwhile. I think, especially for the average deaf person. Generally, what One Gap is this sense of collaboration among different deaf organizations across the country. Sometimes deaf, especially when it relates to advocacy, everyone is doing their own individual work. But when it comes to learning how to advocate together and how to support each other, it becomes an opportunity to really educate everybody. And I think deaf organizations, all of us as a whole, need to really include each other in our work more. For CAD, ASC, but also for all of the different organizations. I know that there's really a high percent of the deaf community across Canada is grassroots. A very high percent. A very small percent are individuals who have formal education. And so I think really we need to do a better job of focusing on the grassroots deaf community. So thank you so much for this. I really believe that, I mean, even myself, I really believe that we're a part of this grassroots community, and that is how we're going to improve access. So thank you so much for hosting the panel today. And really the work that you're doing is incredibly important, but also thank you for the invitation. Travis as well. I am looking forward to seeing all of you at Mayfest. Looking forward to it. Yep, it's May 12th and 13th. I'm looking forward to seeing everyone. Yes, Rich speaking, thank you also. I mean, this is such an incredibly important discussion for all of us to be able to share our own information, but also to receive each other's information. A lot of this is improving the gaps that we might have in our advocacy work, and we're really grateful for the opportunity to be part of this panel today. Hopefully people found it helpful, and individuals are welcome to contact me anytime, any of your organizations here. I'm sure we're all open to being contacted if anyone needs any more information. Kim speaking. Thank you everyone so much. So please remove your camera. Now I do have one more, just one more, everyone off, just one more. I missed who's to stay. I think Wisum speaking. Am I supposed to camera off?
Everyone stay, I think she said.
Oh, sorry, everyone stay, but camera off. So where are the interpreters? So we have a number of interpreters here. We have spoken language interpreters. Alicia, where are you? Alice? Kim speaking. I'd like to say many thanks everybody for all of the work that you're doing, for volunteering your time and donating your time and your skills to interpreting all afternoon. So thank you so much. Looking forward to seeing everybody. So thank you so much. And ASL interpreter saying thank you. Have a great day. Take care. Wonderful. Okay, thank you so much, everyone. And with that, we are finished our panel for this afternoon, for today. And so that is a wrap. Again, thank you so much, everyone, for coming and being a part of the discussion today.